Hello, everyone, and welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. My name is Ann Potempa, and I'll be facilitating and giving the talk today. Our section's vision is for a healthy, safe Alaska, and our mission is to identify and advance the conditions that lead to safe and healthy lives. The primary aspects of our work include health promotion, chronic disease prevention, and data collection and surveillance. This webinar series was created to provide a forum where we as public health professionals can have an open dialogue about specific projects and explore ways to work together. We will be offering webinars on the third Tuesday of every other month at 1 p.m. In addition to sharing our work with you, we hope these webinars will spark your interest in learning more about our projects and explore opportunities for further collaboration. Another way you can stay connected to our work is through our monthly newsletter. You can sign up for the newsletter on our section's website. Our website address is at the bottom of all of our slides. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Also, please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes of open dialogue. The audio for this webinar should be coming through your computer or through a telephone number that was provided for you on the screen. If you have technical difficulties during the webinar, please let us know by using the question panel in your sidebar. You should have a section that looks like this on your sidebar. You will need a microphone on your computer, or you'll need to use the telephone number provided to ask a question out loud. All questions, except for those about technical difficulties, should be held until the end of the presentation, and then we will have more time to discuss. To join a conversation or to ask a question, please raise your hand. We have a picture up on the slide to show you how. On the sidebar, you should have a yellow hand that you can press on. When that's raised, we'll start answering questions in the order they're asked. With that, I'm going to start today's presentation. Again, my name is Ann Potempa, and I've been working with the Department of Health and Social Services for almost 10 years, all of it focused on public health, education, and communication. For the past 5 years, I've focused on the public health education campaign called Play Every Day. The campaign is focused on preventing and reducing childhood obesity in Alaska. Every year, we've been able to add elements to the campaign to ensure our messages are sharing the most up-to-date information and reaching the most Alaskans. Today, I'm going to focus on how we partnered with another organization, the Alaska Native Tribal Health Consortium, to share physical activity stories from rural Alaska. Play Every Day launched in 2012. From the beginning, it's been run through the Alaska Department of Health and Social Services. Play Every Day is a social marketing campaign that goes beyond raising awareness of the health problem of childhood obesity. Our campaign has the goal of changing knowledge, attitudes, and health behaviors related to two key areas. One, getting kids closer to 60 minutes of physical activity every day, and two, reducing children's consumption of sugary drinks, such as soda, sports and energy drinks, powdered mixes, and fruit-flavored drinks. Social marketing uses commercial marketing techniques in the social arena. In the commercial world, you are typically selling a thing, and your exchange tool is money. Here's an example. You want your audience to buy your new dining room table. You tell them how much it is, and you perhaps mark it on sale so it seems more attractive. In the social world, you are selling a health behavior. You are exchanging one health behavior for another. As an example, your audience is drinking soda every day. You want them to drink water or milk instead. Like commercial marketing, our job is to lower the price of that exchange to make it more possible. Maybe money and cost is involved, but often it's another thing. Maybe it's making water an easier drink choice, or perhaps it's making water more available or accessible during the day. Here is another key point. Social marketing typically focuses on voluntary behavior changes. Often there are policies that require certain health behaviors. For example, a school district wellness policy may tell you not to sell sugary drinks to young children in your school vending machines. A policy is one way to change behaviors. Social marketing is another way, and it focuses on educating people about why they would want to make a health change on their own, for their personal health or for the overall society's health. We use social marketing to run our public education campaigns because there's been a number of studies and evidence showing that these types of campaigns, when run through comprehensive tobacco programs, as an example, can promote quitting and reduction in smoking. The CDC has set best practices for social marketing used to promote tobacco prevention, and we follow these best practices for obesity prevention in Play Every Day. Let's talk about the numbers. Childhood obesity increases the risk of weight-related diseases in children, and it's costly to the quality of their life. It increases the risk of type 2 diabetes and heart disease risks like high blood pressure and high cholesterol. In Alaska, about 1 out of 3 children is overweight or obese, and 2 out of 3 adults are overweight or obese. Obesity is definitely costly in terms of dollars. In Alaska, about $459 million is spent every year on the direct medical care costs related to obesity. The CDC has set 6 target areas to prevent obesity: increase physical activity, fruit and vegetable consumption, and breastfeeding, and decrease sugary drink intake, junk food consumption, and screen time. That includes TV and computer time. As I mentioned at the beginning, Play Every Day has evolved year after year. The campaign is addressing new topics linked with childhood obesity. We're creating new communication tools to reach Alaska parents, and we're partnering with new organizations to take that reach even further. This slide shows how Play Every Day has evolved. We started on the left side, focused on physical activity. The campaign motivates Alaska children to get closer to 60 minutes of daily physical activity. It also partners with the Healthy Futures Challenge. This is a free 3-month physical activity challenge run by the nonprofit group called Healthy Futures. The challenge is now offered in more than 200 elementary schools across Alaska every fall and every spring. Between 15,000 and 18,000 children typically fill out these logs every fall and every spring. In recent years, Play Every Day has moved over to the right side. Now we're focusing on sugary drinks and nutrition. The campaign's goal is to reduce sugary drink consumption and promote water and low-fat milk. The campaign also strives to promote healthy food options. This year, we worked with a registered dietitian on our staff to complete a salad recipe book for Alaska schools and similar recipe cards for families of 4. There are a number of possible audiences we could have targeted for a childhood obesity prevention campaign, but with limited resources and dollars, social marketing requires you to target an audience and create your message with that audience in mind. Our target audience is Alaska parents of children ages 5 to 12. These parents determine how their children typically spend their time, whether they're active or not. These parents choose which foods and drinks are in the fridge and on the cupboard shelves. These parents have children who are still building healthy habits, and these parents have children who are of the age who participate in the Healthy Futures Challenge. Social marketing campaigns stand apart from other communication campaigns, and that the end goal is more than raising awareness. It's changing knowledge and then changing behaviors. We have goals for changing knowledge, but I'm going to touch on our 3 key behavior change goals here. 1, motivating children to get 60 minutes of activity a day. 2, serving children fewer sugary drinks. And 3, serving water or low-fat milk instead. I highlighted our first goal because that's the one I'm going to focus on primarily today. Another key step that sets social marketing campaigns apart from their communication campaigns is that they rely on research to do 2 things. 1, inform and guide the messages for the target audience, and 2, evaluate the messages to ensure they are reaching the audience and doing their job, changing knowledge, attitudes, intentions, and behaviors. To inform our messages, we use focus groups and key informant interviews with our target audience. To evaluate our messages, we have typically used telephone surveys of our audience. Let's focus on that first behavior change goal, motivating children to get 60 minutes of physical activity every day. For the past 5 years, we've taken a number of different approaches to motivate this behavior change using what's called 30-second TV public service announcements, or PSAs. This year, we tried something new. We wanted to find real Alaska stories of adults and parents using unique and interesting ways to get kids moving. And for the first time, we were able to tell these stories from rural Alaska communities thanks to a partnership with the Alaska Native Tribal Health Consortium. ANTHC receives a multi-year grant from the CDC's National Center for Chronic Disease Prevention and Health Promotion. The grant's efforts and Play Every Day's goals are very similar to prevent and reduce chronic diseases such as type 2 diabetes and other diseases associated with overweight and obesity. Play Every Day and ANTHC used focus groups to test 5 different stories from 5 different rural Alaska communities. The physical activity stories came from these communities: Barrow, Galena, Unalakleet, Bethel, and Angoon. Then we intentionally scheduled 4 focus groups in communities that were different from the communities where the stories took place. We didn't want communities to be too familiar with the stories we were going to share, which could have influenced their input on which story was most meaningful and motivational to them in terms of increasing physical activity. We invited our target audience, Alaska parents of children ages 5 to 12, to attend focus groups in these 4 communities: Kotzebue, Dillingham, Yakutat, and Anchorage. About 8 to 12 parents attended each group. Here's our first story idea. Angoon is a small community in southeast Alaska. You can get there by float, plane, or ferry. 3 moms in this village decided to work together to bring physical activities back to young kids in Angoon. One mom started a cheerleading program after school. Another started a basketball team. A third mom started a running club. All of these moms volunteered their time to add activities for Angoon children. Every summer in Barrow, circus artists fly in to provide a 2-week camp for almost 100 Barrow children. Kids ages 5 and up can attend every single day at no cost to them. The camp has been running for the past 8 summers in Barrow. It's also run in the surrounding North Slope villages. The Circus Camp in Barrow is fully funded by a federal diabetes grant, the City of Barrow, and Ilasagvik College, Alaska's only tribal college. On the camp, Barrow kids learn unique physical activities like walking on stilts in a tight wire, hanging on a trapeze, and tumbling. Another story idea came from Bethel, a rural village on the west coast of Alaska. This story featured Carolyn and Shane Iverson and their 3 young children. Carolyn is Yupik and has called Bethel her home for most of her life. She's a social worker at local schools and also coaches young girls in basketball. She asked her husband to be her assistant coach so the whole family, their kids included, could play in the gym at the same time. Shane coaches soccer in the summer. They also do cultural and traditional activities like picking berries and heading to fish camp. They do low-cost, easy physical activities like jumping at the local sand dunes. Our 4th story idea came from Galena, a community of about 500 people along the Yukon River. Galena had a new physical education teacher last year. He decided to sign up his elementary school for the free Healthy Futures Challenge. The Galena school had about 60 students. In his first month running the challenge, this teacher achieved 100% participation from his students. Our final story idea featured Nick Hanson, an Inupiaq man who calls Unalakleet home. Some of you might know Nick because he competed this summer on the American Ninja Warrior NBC show that challenges athletes to complicated obstacle courses. Nick has built a similar ninja course on the beach of Unalakleet. You can see that here. He made it all the way to the finals of this year's Ninja Warrior show. He's also very accomplished in Native Olympics, setting the world record this year in the men's scissor broad jump. But Nick cares about more than just his own achievements. He's invested in the kids of Unalakleet. He coaches multiple sports. He has a free running club in the summer, and if kids want him to play an outdoor game at night, he's happy to do it. We tested each of these story concepts in our focus groups in a unique way. We asked the people involved in the stories if they would share information with us, and then we wrote a 2-minute script for each story. We had a colleague within our department record those scripts so they could be played at the focus groups. Then we asked the people involved in the stories to share photos of their activities. When the focus group participants heard the scripts, they watched the photos appear on a screen. Then we asked the focus group participants questions, which they answered independently on a printed worksheet and afterward out loud in discussion. Here are the questions we asked them. Is the story you're seeing and hearing memorable? Does it give you new ideas about physical activity? Does it share ideas that are relevant and possible? Is this the kind of story that motivates people in your community to make similar activities possible? And is this the kind of story that motivates you to get your family more active? We chose the two stories that were considered the most meaningful and motivational among the Alaska parents who heard them in the focus groups. Those stories were the Iverson family in Bethel and Nick Hanson, the American Ninja Warrior from Unalakleet. This is what we heard from parents about the Bethel story. Being physically active as a family is important. The Iversons help their own family be active, and then they share their time helping other children too. This is a quote from one of the participants in the focus groups. Finally, family, 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 making their own effort to provide activities to their children based on what's around, not what's being brought in or who's a superstar. The family is relatable. They choose activities that are relevant across the state, and this family made other parents in these focus groups believe that they could do these types of things too. The family also chose subsistence physical activities, which were very important for the focus group participants. Berry picking and heading to fish camp are important to the Iverson family. The family has a fish camp on the Kuskokwim River, and the whole family, from grandparents to small children, spend many days there catching fish that will feed them throughout the year. I mentioned both parents in this family coach sports. Carolyn coaches basketball and Shane coaches soccer. But parents in the focus groups noted that this family also went beyond organized sports and picked easy, low-cost activities for their families. Jumping in sand dunes, chasing bubbles in the backyard, and setting up a plastic basketball hoop in their living room so they could play games inside. The key, according to the Iversons, is to make physical activity possible every day by finding ways to weave it into your lifestyle. This is a quote from the mother. Sometimes people think physical activity needs to be separate from their daily lives. When you can incorporate it into your daily lives, that's when it will be easiest to maintain. When they saw the Unalakleet story, parents of the focus group told us that this was a story about an inspirational, motivational man. This story showed that one person can make a difference. Quote, "This is an Alaskan success story. Thought it could be motivating since it's a story of us." The story focused on a well-known athlete in Alaska, but showed how he went far beyond just caring about himself. He helps Unalakleet kids and families get moving in creative ways. As one parent said, "Nick knows what is fun for kids." Our focus groups inform more than just the storylines of our PSAs. They inform the materials related to those PSAs, from posters to Facebook posts to website content. When we film PSAs, we often create a poster series that complements the message. We send those posters to hundreds of schools, WIC clinics, public health centers, community health aid clinics, and other locations. These are examples of the posters we created from photographs captured during the filming of our PSAs. I'm now going to show you the PSA featuring Nick. It is airing on TV across Alaska right now, as well as online and through social media.
You may know me from American Ninja Warrior, but in my hometown, kids know me as their coach, mentor, and friend. We play together to get better at what we do and to stay healthy. That's why I started a running club to get everyone moving. And if kids start a game with the whole village as our playground, count me in. This is how we get kids moving in our community. What can you do in yours?
And here's the PSA we filmed with ANTHC this June. It features the Bethel family, the Iversons. It is also airing on TV, online, and through social media.
Our family is always busy, so we make physical activity a part of our daily lives, in school and outside of school. We coach, we play, and in the summer we head to fish camp. We do it together as a part of our community and our culture. Being active keeps us healthy and helps kids feel good about who they are. This is how we get kids moving in our community. What can you do in yours?
All of our PSAs and videos can also be found and watched at any time on our website, which is playeveryday.alaska.gov, and our YouTube channel, which is playeverydayak. Here is our website. Again, the web address is at the bottom, playeveryday.alaska.gov. We have a rotating photo banner at the top that helps you see the main part of our campaign and click to the sections you want to see more of. This rotating photo banner shows you still photographs from the filming in Unalakleet. When you click on this rotating banner, you are taken to our new website that hosts the video films for our physical activity PSAs, the ones we filmed this year and also past PSAs, as well as the posters that match them. You can find older versions of our PSAs and posters here as well. As you can see, we have the posters in JPEG and PDF format in various sizes. So if you have printers on site, you're more than able to print these off and hang them wherever you are. We have print versions in our office too, and so you can always reach out to me to get copies of those. The best email address for me, other than my personal one, is playeveryday@alaska.gov. Play Everyday's TV PSAs aired on broadcast and cable stations statewide. They ran during the Summer Olympics in August 2016, and they're running September through early October. We also have a presence online and through Facebook ads and posts. Our posters went to 200 schools across Alaska, primarily through our partnership with the Healthy Futures Challenge. They'll go to WIC clinics and public health centers, and ANTHC has also received extra copies to distribute through their organization. That is all I have for you today. Thank you very much for listening about the partnership with ANTHC and Play Every Day. Again, here's my contact information. My email address is ann.potempa@alaska.gov. And my direct line is 269-3433. This webinar will be put on our section's webinar site in the upcoming days, as well as an attachment of this PowerPoint. And we're happy to take any questions at this time. Feel free to type the questions in, and if you have audio capability, you can also speak them into your computer or phone. Not seeing any questions come through at this time. Like I said, my email and my contact information is there. You're welcome to contact me directly at any time with any questions you have about Play Every Day. Oh, a question just came in. Can you, let me just scroll up again. I wonder why it's not showing you. What results of your campaign have you seen so far? That's a great question. I'll talk sort of briefly how we look at results. When we do our campaigns, we typically do telephone surveys of Alaska parents across the state, either in urban settings or statewide, depending on our campaign. As far as this particular campaign goes, I am working with ANTHC right now. They're considering some evaluation options to explore in terms of these two new ads that we've done with Unalakleet and Bethel. Unfortunately, due to the timing of these ads, it's not an ideal time for us to do a telephone survey because this is primary time for political polling. And so it's just not a good time for us to do a recall survey. So we're not using that approach at this time. But ANTHC is looking into other approaches in order to evaluate this particular campaign. The question is, you talked about how the focus is now moving to diet. I missed some of the presentation, but what efforts are you being made to promote healthy diet? That question came from Kevin. Kevin, thank you very much. I will say at this point, most of our nutrition focus is being put on reducing sugary drink consumption and promoting water and low-fat milk. There was an effort in which our campaign worked with a registered dietitian on staff to create our first salad book. It has about 20 different salad recipes that are made in bulk for Alaska schools to use through their salad bar programs. But we also made complimentary smaller recipe cards to put those healthy salad recipes into sizes that can be consumed by families of 4. And those are on our obesity prevention website. If you want that resource and can't find it, please feel free to email me at another time. What is next for Play Every Day? That's also a great question. In terms of our sugary drink campaign, we're excited to begin a 2-year grant through the Centers for Disease Control that just began in September. We're going to be working with our State Department's oral health program, in order for our oral health providers, dental health providers, and our obesity prevention public health professionals to work together to reduce sugary drink consumption, both in terms of the health of the mouth and the health of the rest of the body. And so we just started that effort. We're going to be making some new materials, likely PSAs, handouts, posters, and other materials that we can share through dental provider offices in the next 2 years. So that's the main new direction for our campaign at this point. We're also continuing to work with ANTHC to share and promote these 2 new physical activity public service announcements. They're going to continue to be shared through television in the next few weeks and then online through the rest of this year. That's all the questions at this time. Oh, there's another one. Kevin responds back, this is a very exciting and potentially impactful project. How does this compare to what other states are doing? Kevin, at this point, I am not sure. I will say there were a limited number of these grants awarded from the CDC across the country, but I'm not sure how many of those other states are taking the similar approach we are by using Play Every Day's current established social marketing campaign and expanding it to reach out to dental health providers. Stay online for a couple more minutes before we wrap up at 1:30. But again, you're always free to welcome to reach out to me, and.potempa@alaska.gov or playeveryday@alaska.gov. Our website again is playeveryday.alaska.gov. Our YouTube channel is Play Everyday AK, and our Facebook page actually has the same ending, which is Play Everyday AK. All right, thank you very much for attending. Please stay tuned for the next webinar series. We'll be sending out information for that in the coming months, and we'll be sending that email out. Thank you.